So today's lecture will give a high-level overview of a number of potential technological areas where in the last 20 years, the data and apps and mobile devices enable us to look after our health, shape our well-being, improve our nutrition, our fitness, but also provide an invaluable service for public health, preventions, control, and early warning for pandemics and epidemics like the one we're living through today. So if we look into the first bit of challenges I have brought to you today, well, how social media, news, and all the data and mobile devices and apps are shaping the way we interact with our healthcare providers, our GPs, and also how we learn about our health. Unsurprisingly enough, mobile technology has been rocketing in the last 20 years, not just for entertainment and communication, but also for health. There has been a double number of people over the last 10 years who started using their cell phone for looking up health information, booking a GP appointments, checking the values and measuring their progress using wearable devices, Fitbits, etc. The phone has become really an indispensable device to manage our healthcare anywhere around the globe. Well, it's not just the phones and the apps we are using to manage our healthcare and sharing our data. It's also the other devices, the Internet of Things devices, which are now easily connectable to the internet, and all devices like weights and Fitbits, various measuring devices like you can see at the bottom of the screen. They all can be streaming information about our physiological values, about our heartbeat rates, and can measure our real-time conditions and inform our healthcare providers if there is something perhaps going wrong, and immediate attention needs to be given, like people who suffer long-term heart conditions, or also could be used for tracking our fitness levels. So in addition to the devices and the data we all accessing through social media, there is one large field which is also extremely important in public health, for public health communication and information of public. It's the media. The media has moved online 25 years ago. However, it has really gained a dominant importance, especially around major public health events like epidemics and pandemics. Unfortunately, it's usually the lower quality, not evidence-based outlets who are getting the best headlines and promoting information from not public health professionals, but often from industry or politicians who not often acting responsibly. So causing misinformation, so-called infodemia, as opposed to infodemiology, and also creating sometimes purposefully fake news. So our responsibility as citizens and as scientists is also working with the media, trying to understand where the misinformation comes from and trying to fight it as soon as we can to stop this massive wave of misinformation. So I'm not going to take you back 10 years to the previous pandemics. It was the swine flu pandemics in 2009. It wasn't as devastating as the one we're living through right now, but it was also very important. It was important because at the time, at the early days of Twitter and social media outlets, it was demonstrated that Twitter can actually help us to predict pandemics several weeks before the official authorities know. So I'm going to take you back and show you a film demonstrating how this could be achieved.
A single idea has the potential to change healthcare forever, and the UK has an impressive tradition of innovation that has transformed healthcare.
In countries where the government is suppressing free media, Twitter or any public-generated content on the internet and social networks could be an invaluable resource identifying possible infectious disease outbreaks.
Our final presenter is Dr. Kostkova. She is going to talk about how e-health and social networks will improve global health by 2020.
I have a question for you. How many of you have got this device on you at the moment? Virtually everyone. So my talk will show you how we can make the use of our day-to-day communication device for improving our health.
As people and diseases travel the world, Europeans face an increasing range of threats from existing and new epidemics. Stockholm is where Europe's watchdog agency was set up.
We have come to the ECDC, the European Centre of Disease Prevention and Control, which has got remit to support European nations and member states in regular surveillance of infectious diseases and providing scientific advice.
Patty, this is our Hall of Fame. Here you have the infected mosquitoes during the chikungunya outbreak in Ravenna. This one was during the tsunami response in Banda Aceh, 2004. This is in Iraq during the avian influenza cases in 2006. This one was a hospital infection investigation in Russia, minus 24 degrees. Actually, the center was created after the SARS epidemic, where the member states realized that for such threats as SARS with a global scope, then there is a need to have some coordination at the EU level. In 2005, there was an outbreak of chikungunya, that funny tropical disease originating in Central Africa. So we decided to conduct a risk assessment because that's really what we've been created for. What's the risk for the EU if a situation emerges somewhere in the world? Everyone was convinced that indeed there was a risk for the EU to see some transmission occurring there. So then the preparedness group started working with the member state to make sure that if it happens, we have the capacity in the EU to diagnose it. Nobody was able to diagnose that disease in the EU because it never happened in the EU. And then in August 2008, we had the confirmation by Italy that indeed the establishment of the local transmission in Emilia-Romagna had started. And it was exactly the story that our risk assessment showed. It was actually one guy coming back from India, meeting at the wrong time, the wrong mosquito, and starting a transmission. Ended up with more than 200 cases.
The spread of this disease from Italy was contained, and the ECDC learned about how to prevent future outbreaks of chikungunya. Early warning of epidemics is crucial, and that's why the team constantly monitors both medical reports and all the world's media. A daily meeting considers current threats.
On other news, there was an AWS from Belgium yesterday reporting an outbreak of measles in Ghent. We knew about this because it was on the media, at least, that there was this situation in Belgium, so they gave a bit more details about this.
So we got it in the media before we got it from the national authorities.
A week before, I would say.
Last year was the worst year in a couple of years that we had in the EU for measles, and what you're saying is that this year so far it seems to be even worse. So.
Allows you to tell the world, or at least the followers, what you do at the moment, what you had for breakfast, whether you had a shower, which talk you're attending, what happened at your work. So what about swine flu? We have done a study collecting all tweets containing the word flu. How many tweets containing this word do you think we have received? Any guess? 10, 20,000? Surprisingly enough, we received 3 million tweets from all over the world discussing some kind of aspect of the pandemic or forwarding some of these articles mentioning the influenza. So we look at these particular tweets and compared what the surveillance data from GPs actually told us about number of cases in the UK last year. And the Twitter discussion slightly anticipated the surveillance reported data. So the Twitter discussions in this large quantity, even though with the noise, which is part of it, can actually predict the pandemic up to a week, in this case, before the official surveillance, which is important to know for the authorities, for preparedness, for organizations like WHO, ECDC.
The vast amount of data can indicate there is some kind of public concerns, and we can crowdsource the intelligence straight to those people who might be affected.
Prior to the internet, my concern was to get as much information as I could. Now that I have internet, my concern is to get, I wouldn't say as little as I can, but as relevant information as I can.
Yeah.
I do feel a little bit skeptical about using social media for early detection. I think it's definitely a tool or a development that we need to be following up, very much in the way that you've been doing with your groundbreaking scientific work.
Don't you think investing into research into the social media, and not just Twitter, including blogs, any of this user-generated content on the web, and finding out technologically better adjusted methods
Indeed, it
save
could
lives?
be great to get some students or interns and get a project, look at the threats, what Google gave us, what the tweets would give us, what Medicis and the media would give us.
What the blogs would give us?
We have a new increase of cases in the Sud province and in the Sud.
The beauty of Twitter was this was tapping into a resource people are using anyway. People are using in their daily life to tell their friends. We are piggybacking on this daily process and capitalizing on this new way of communication and using it for public health purposes.
So my warmest welcome to those of you who joined our session in the last 10 minutes while we were watching the film, taking us back 10 years to the previous pandemic and showing how social media, specifically Twitter, 10 years ago could have predicted the increase of swine flu in the UK and in the US up to 2 weeks before the official authorities. The role of social media for early warning systems for pandemics has been growing, but as you can see now, living through the COVID-19, we still have a long way to go. So the second challenge I'm going to bring to you today is moving from global pandemics to a specific pandemic, which is unfortunately endemic in most countries in the tropical regions, specifically in Brazil. My research takes me to Brazil to investigate the Zika virus in the northeast part of Brazil. Zika virus is transmitted by mosquitoes. It's a mosquito vector-borne disease, which isn't really fatal for humans. That's why it doesn't receive so much attention as COVID-19 and Ebola and other epidemics with much higher mortality rates. However, unfortunately, this disease is very difficult and very dangerous for pregnant women. In 2014, there was a major outbreak in Zika in northeast Brazil, especially in pregnant women, resulting in a devastating defect of the newborn babies. So stopping the transmission of Zika virus means controlling the mosquito. If you control the mosquitoes, they can't transmit Zika, and the number of human cases and the devastating number of cases of a newborn babies goes rapidly down. And this has been part of our research over the last 3 years. The local so-called healthcare agents have got an interesting job. They go around people's houses and they're checking the availability of standing water. And imagine you're working in a part of the world where sanitation is very limited. Some people haven't got running water, haven't got flushing toilets. So they have got standing water in their gardens and in their courtyards because this is the essential way how they have actually access to water for their households. So healthcare agents are visiting properties and checking if mosquitoes are breathing in any of those standing water points and destroying them and reporting it to their authorities. This is a daily long spanning surveillance program undertaken by hundreds and hundreds of healthcare agents in cities in the northeast Brazil. However, they have been so far doing it on a paper. So they have a paper form where they fill in which property they visited and what water standing containers they have discovered and if mosquitoes were or were not present and if they destroy them. What we developed in my center in DPHE is a mobile app. As you can see on the screen, the mobile app allows them, it's all in Portuguese, to enter the information they normally have been entering on a paper form, and then they can send the information immediately in real time back to their managers and supervisors in the public health agencies, and they can visualize where in the city of Recife the mosquitoes could be potentially breathing, where the hotspots are, so they can concentrate their effort and activity, not just randomly surveying all the properties the way they do now, by focusing and doing rapid response to the high risk, high hotspots area for breathing of mosquito, giving their work much more of an impact and effectiveness in controlling the population of mosquitoes and subsequently reducing the rates of Zika virus. The managers like to see what's going on and where the agents are and where the mosquitoes are being destroyed in real time, which, as you can imagine now with the paper-based systems, is not possible. So with the map-based system, receiving the data from the mobile phone app we developed for the agents visiting the properties, they can immediately see which district is high-risk district, where the mosquitoes seem to be, for one reason or the other, breathing in large quantities. And they can investigate potentially which properties could be badly affected and direct additional agents or additional support to address the outbreak specifically in those properties or in streets or so-called blocos. The work in Brazil is demonstrating another way how the combination of mobile technology and the big data we are collecting through the mobile technology surveillance can help the local stakeholders to not just do their work more effectively and more efficiently, but also have the early warning advantage where their work could actually save lives. Moving back to Europe, it's not just mobile phones and big data and surveillance apps. It's also serious games and games analytics for health, which have become very important channel for information and for education of citizens. This project will take us back to a large EU study aimed at children, developed by the UK with 10 partners across Europe, teaching children about microbes. Primary and secondary kids need to know what fungi, bacteria, and viruses are, and how they can protect themselves by things like washing hands to stay healthy. So it was a large educational project aimed at school age children in a primary and secondary age. It was about, in the UK, so 10 to 12, and then 14 to 16. So as you can see, we had very talented artists who have very realistically drawn how bacteria and viruses could look like. They also use this kind of color coding. So the lighter ones are the good ones for our body. So like the fungi with tentacles is a penicillin, which can help us to stay healthy. Some of the ones pulling really aggressive faces are the bad ones our body needs to fight to stay healthy. The kids also were to understand, bacteria are too small to be seen, but that they could exist anywhere in our body, on the skin, inside our bodies, or in the kitchen. So the project had a number of learning objectives, which were linked to the learning curriculum in various countries in Europe to teach those basic principles of hygiene, microbiology, and also the concepts of antibiotic resistance. And as you can imagine, kids love it. Who wouldn't love playing games at school? So in the game, this one is aimed at the junior children in a specific level, they were supposed to understand that actually microbes are not all bad for us. Some of them are really good, such as those we are using to make a yogurt. So in this level, the player, as you can see, this little girl on a skateboard, and you could choose your avatar. It was a boy and a girl, was supposed to push Lucy lactobacillus into a glass of milk. And when you have done it skillfully 3 times, if you have pushed 3 Lucys into a glass, understand that actually using bacteria like lactobacillus is good for us, because this is how we make the yogurt we eat every day. This learning objective actually has been the most successful in terms of achieving sort of knowledge game and understanding as a result of the game mechanics implemented through this particular level. Another level was aimed at antibiotic resistance. As you know, antibiotic resistance is a global phenomenon, which is as important as maybe global warming, just slightly less known, which may result, if it's not addressed by international collaboration, in the drugs we know just no longer working, and it may result in millions of deaths. So not misusing or overusing antibiotics is everyone's business. In this particular game, the kids were not just to understand how antibiotic resistance is developed and how they can prevent it, they were to understand that if they are ill and their doctor prescribed them antibiotics, they should finish the course, because not finishing the course, even though you may feel a little bit better, also contributes to the drugs becoming resistant, and it's driving the global phenomena of antibiotic resistance. So as you can see, the avatar, the girl is trying to destroy this horrible infection in your body. It's pink, isn't it? It's really horrible. And she's throwing the antibiotics, and one after one, and then she feels like, wow, it's all gone. However, she still has some antibiotics left in her pocket. So if the player stops here thinking, they have destroyed the antibiotics, they can just move on to the next level. No, they can't. They're going to lose points because they haven't achieved what they were meant to achieve, which is finishing the course before destroying the antibiotics. And as you can say, after a bit of a while, it grows back. So now she has learned, well, it has grown back. She has to use the very last antibiotics to get rid of it for good. The game was evaluated in 10 countries in Europe. Especially initially, it was in English, and then it was translated into all the local languages, so the children could actually learn in their local language. But it was very unsurprising that a lot of kids who spoke good enough English and kind of learned not just from the text, but also from the mechanics of the game, just like throwing the capsule on the infection, or throwing Lucy lactobacillus into the glass of milk. And the mechanics actually has been as effective in teaching the learning objectives as the initial test, which demonstrated our research. So if you like playing the games, it's on the website gamesforall.org.uk. You're most welcome to have a go. We also have games for the teenage children, as I mentioned, the senior school children, which are more storytelling games where you investigate an outbreak and need to find out who has caused a big outbreak in some country. So this is much more kind of a detective-like game, but also even the teenage children love playing the junior games aimed at the primary school kids. So you're most welcome to have a go. Moving on, we travel around the globe to a small country in the Himalayas called Nepal. And what do you think? Games, this is just for children. Yeah, kids like playing the game as opposed to studying from textbooks. That's true. But also, women who might be living in the most deprived country in the world can also play games. One of the most challenging, and from my perspective as a researcher, rewarding project was the project called MANTRA. MANTRA stands for Maternal and Newborn Technology for Resilience in Rural Areas. The aim was increasing maternal and child and neonatal and after disasters, and also increasing knowledge of geohazards in this earthquake hit part of the world. So as you can imagine on this picture, there are village women from rural Nepal, and they're meeting every month for kind of discussion groups. But these discussion groups are often replacing health education and primary health care provision, because in those countries there is very, very limited access to healthcare due to poverty and infrastructure issues. And they work with so-called female volunteers, female volunteers, community workers, FSVCs, who visiting these groups, and they're helping them to understand how to manage their healthcare, how to look after their babies, to increase their knowledge, their health knowledge, and also decrease death. The picture on the right, the yellow picture, this is a local health post. So it's not a hospital, it's a health post where women can be transported to give birth. And part of the project was addressing this very devastating issue in Nepal, which is very high female mortality during birth. So one of the major learning objectives and impactful objectives of this project was to help women to understand which condition during pregnancy and birth or after birth with their baby is fatal, is critical, and they have to make their way to the nearest hospital or health post like this, or which conditions is just normal and they don't have to worry. The interesting part of this project was, well, we work with audience who are people from very, very remote parts of the world. Most of them live in poverty, and they don't have mobile phones. So the idea of using mobile phones and smartphones, some of them actually seen first time in their life, to teach them something about their health, seemed bizarre, but it seemed also really challenging. So we have divided the game according to the initial grant requirements, working with our local stakeholders in Kathmandu, an organization called EHealth, doing an amazing work in health and maternal health education. We divided it into 3 modules addressing maternal health, so pregnancy, modules for neonatal health, so looking after your newborn baby, and a module looking at the geohazards. So how do we better understand what is and what is in danger in terms of landslides or rock falls, which are very typical, and obviously earthquakes in a country like Nepal. The game was using a really simple drag and drop technique. No text could be used because a lot of the women are illiterate to communication of the messages in the game. It had to be 100% pictorial, so 100% images, and a communication, an interaction had to be communicated in a way which was locally understood. So for example, on the first picture, which is from the maternal module, the player, the women should choose if those 2 conditions, which one is dangerous. So, a serious bleeding through during the birth, is it more critical than a white discharge? So they should correctly decide that bleeding during the birth, if it happens to be, they happen to be giving a birth at home, which is unfortunately, despite the risk, very common in rural Nepal, is a critical condition, and they need to call an ambulance. There's also a lot of culture issues. A lot of women haven't got the right and say about their health-seeking behavior. They rely on their husbands and often in their mother-in-law to make these decisions for them. So a game like Mantra help them to be empowered and be much more sure about what is and what is needed of them in case of emergency or high-risk condition for themselves and also for their newborn babies, which eventually could save lives. These are examples of the geohazards. So, large cracks, can they or can't they walk through large cracks or rock falls? Can they walk closely to the edge of the rock without risking a rock fall? So making decisions about better navigating their way in their valleys and in their environment was also very important, because more people in Nepal died after the aftermath of the devastating 2014 earthquake than during the earthquake itself. Exactly because of this, people were smashed by falling rocks. They fell into cracks. There was a rock fall and they didn't see it coming and got hurt or killed. So the geohazards were as important as the maternal and neonatal health. You can see these little flowers, a pink one and a yellow one and a purple one. We couldn't include any points because, again, points would include numbers, and numbers was something we could not include due to the low literacy level. So if you made your question, if you answer your question right, you would be earning a little leaf, and this little flower was growing. So you can see on the yellow one, it has grown by 8 points. So 8 answers were correct. So again, this was an artwork we have discussed locally with iterative focus groups with the women in the villages and our stakeholders in Kathmandu to make sure we communicate the kind of rewards of the game as accurately as possible and for the local audience to understand. We also integrated a sound, so if you did something right, the locally recommended sound was like a singing of birds. It was a beautiful little audio we have been given to play, which communicated the right answer and reassuring correct answer, or there was a big cross if you made a wrong answer, and a sound of a thunderstorm, again, kind of communicating a danger or something being wrong. So immediate feedback was also integrated into the very fabrics of the game to immediately teach the player whether the answer was correct or incorrect. So we measured how the games in 3 different parts of a district south of Kathmandu, which was a Kabra district, which was worst hit during the 2014 earthquake, how they learned from the game, looking at what they knew about these learning objectives before and after they played the game. And we could demonstrate there was a significant improvement of their knowledge and understanding the risk of the diseases. And we also did focus groups with our interpreters and facilitators back in Kathmandu with those women who very much enjoy playing the game. It was amazing to see people who didn't know how to use touchscreen, who didn't know how to use drag and drop. After 5 minutes, getting used to it and really enjoying it. And it was a really amazing thing to be part of and contribute to improving their knowledge and hopefully their resilience and future decisions about healthcare seeking behavior, potentially saving lives. As you can see, some of the answers from the focus group, you know, they keep saying how much they like playing the game and they felt it was great to play the game. And also they expressed that they understand it is beneficial for them to understand the health about the mother and their child. So it was great that, you know, even though we only have a limited number of sessions, they have been actively involved, have been actively engaged in how the game should be shaped, how the artwork should be done, and really enjoyed the final product, the pilot we evaluated, and would love to play it even more. So leaving Nepal behind, we're gonna fly to a different continent, and this time it's Africa. In Africa, we have developed an app, one of the many interventions addressing the global issue of antibiotic resistance. This particular project is based in Nigeria, which is the largest country in West Africa, and we work in hospital settings, not in rural setting, but in 3 hospital settings with surgeons who are prescribing drugs for elective surgeries. So as I mentioned, antibiotic resistance is a major challenge of our times. And if you just want to see the numbers, you know, the failure of addressing antibiotic resistance in the next 30 years may result in 10 million deaths. It may be costing the economy trillions. So once imagine it, you know, diseases like TB and any common diseases we now used to being treated through antibiotics for the last 50 years since the invention of penicillin would no longer be treatable again, and we're going to move our healthcare back to 19th century. So addressing antibiotic resistance and slowing down the process of the bacteria becoming resistant to existing drugs is an essential global challenge. So what we can do about antibiotic resistance? So, well, one of the things we can do is stop overprescribing. So we've been using antibiotics when we don't need them. There has been a study in the UK I was involved in 15 years ago. It's called Backs or Drugs, where it was demonstrated that a lot of pressure on GPs in the UK comes from patients themselves. They have a cough and cold. They actually don't need antibiotics because it's often viral, and therefore antibiotics wouldn't even work. But they demand a prescription because they feel that their GP should be prescribing them something. So there's massive pressure from public and from certain part of the population on getting prescription, even in cases when it's not needed. So thinking hard about, do I have a cough and cold in the winter? Shall I just stay in bed, get rest, drink a lot of fluids, and normally after 3 or 4 days, most people would get better. Obviously, if not, you should see your GP. However, seeing your GP immediately and putting pressure on prescription is exactly what contributes to the antibiotic resistance phenomenon. So in the Gutstab project, we look specifically at how we can lower the overprescribing. And we didn't work with patients, we work with the healthcare professionals. So how the healthcare professionals could be empowered to make the prescriptions correctly according to WHO World Organization guidelines, and also how they can reduce unnecessary prescribing. So how they can perhaps reduce the length of the prescription they're giving to their patients in Nigeria. So the mobile app has communicated the message about prescriptions for a variety of surgeries. We work with surgical departments, and we have assessed whether the operation was high risk or low risk, and whether the patient potentially was high risk. Someone may have underlying conditions and may require antibiotics to protect the patients from sepsis or from some infection. So it's not that all antibiotics are bad, it's just the compliance with the guidelines and prudent prescribing are very important to be implemented to drive down the antibiotic resistance issue. So in this app, we have developed feedback, again, a kind of persuasive game feature to enable the user to immediately know if the decision they have made was correct and incorrect, and giving them a chance to change their prescription decision. So as you can see on the left-hand side, the red feedback is highlighting the issue that the decision wasn't correct, it wasn't compliant with WHO. Was correct, it was in compliance with WHO. So we reassure the surgeon, this is the right way to make the decision. You can just continue, no need to be changing your decision. You can see, well, what is this dog doing in the app, and the dog giving the message about right or wrong feedback about the decision. Well, mentors are important sort of figures of certain authority integrated into the serious games and persuasive game theory, which communicate, which create kind of a relationship with the player and communicate certain message. And we have developed a number of potential mentors for the Gutstab game in Nigeria, obviously ranging from a doctor, a female and male doctor, and young and old, and also objects like prescription books, and also a number of animals. And we had a big focus group with the experts in Nigeria to tell us what they would like to have as a mentor. And we were very much surprised that they have favorite mentor wasn't a doctor, it wasn't a female or male figure, it was actually a dog. But the dog was supposed to be wearing glasses, looking like a doctor, and also wearing a stethoscope and a white coat. So it's a doctor dog. The local experts decided would be the most appropriate mentor for their game. So it was an amusing result. We also have evaluated this game over 6 month periods in the 3 hospitals, 2 in Lagos and 1 hospital in the Delta region. It's more in a rural part. And we have demonstrated the opportunity of the app to change the decisions and increase the prescription compliance with WHO guidelines. So we have demonstrated that giving sort of just-in-time, real-time decision feedback at the point of care where the surgeon is deciding, not going on a training where they learn about antibiotics and they should be reading WHO guidelines, which, as you can imagine, will be 200-page document no one has got chance to read while they're conducting their surgery. Giving the right decision for the very decision they are making with the patient for specific surgery at the point of care is what makes the change and what makes the difference in terms of improving their prescription behavior and increasing compliance. And these are just pictures of the 3 hospitals where they work. So these 2 are in Lagos, and this is the hospital in the Delta. So the project was really successful. It received several prizes, and now we received funding to evaluate it in the UK, in UCH. University College Hospital. So we'll see how a technology which predominantly was developed for local needs in Nigeria and Africa can be easily transferred and localized for high-income settings and for a leading teaching hospital in the UK. So come in next year, and I will present you the results from the NHS, the UCH study. So finally, what are we doing about COVID? I've been working in digital public health for 20 years, and I found this an amazingly exciting and challenging discipline. You can be not just affecting lives and knowledge and healthcare behavior of individuals, but also you can be affecting the whole population. The whole kind of remit of public health is addressing issues at the level of population. So enabling vaccinations, getting people better informed about their healthcare behavior and antibiotic resistance, preventing epidemics. So it's been a real challenge and a real excitement for myself and my group to get involved in fighting against COVID this year. We have started a number of projects, and I'm going to just demonstrate you our biggest project called My Lockdown Journal. We developed an app rapidly repurposing the IT technology we have for the other projects for the needs of the lockdown. So as people can be journaling their lockdown experience and post-lockdown experience, to know what they're doing, to have an overview of how they're spending their time, because it's been challenging to be at home for so many months with the normal structure of our lives being dramatically changed with very rapid weekly changes happening after the big lockdown being closed. So it helps people to keep positive. It helps well-being. We also work with a number of mental health charities who are interested in promoting the app among their clients to increase well-being and sort of positive thinking and decreasing anxiety. We've also launched a social media competition. So if you send a picture of what you're doing at this period and you use a hashtag #MyLockdownJournal, we're going to retweet it and we're going to enter it into a weekly competition where the most exciting image of lockdown activity or post-lockdown activity is being shared, and is being shared with everyone who is involved in the competition, and it's also being put into the app, so all the app users can see the people who are sharing the social media images. We have also developed a longitudinal survey, which is kind of more formal side of the research, giving us some insight into how people adapted their activities, what they're doing online, what they're still doing offline, if people are doing things on their own or they have changed the way they have been doing previous activities, and we evaluated that after the first 2 months. Interestingly enough, people got much more active. So running and walking have been very popular. Most of the 5,000 people who responded to the study have been doing running or walking at least once a day. Also, meditation and yoga have been also on rise. So people have been much more active in trying to find time for slowing down and meditating, also at least once a day. And in terms of the kind of age spectrum, young people seem to be feeling more stress and high levels of anxiety, while older people, kind of 65 plus, seem to be coping much better. So this study is ongoing, so do download the app. It's available on Google Play Store. It's called My Lockdown Journal. And if you have got an interesting ideas about what you have been doing in the lockdown or what you will be doing throughout this social distancing periods, we will have local lockdowns already. This is going to be going on for maybe the next year and a half or 2 years. So you can enter your ideas into the competition, and perhaps you can be a winner of one of the next weekly awards. So my center has received a number of awards and media coverages. So these are just some examples of the work of our work being covered by a variety of media. We also got a lot of awards. So I'm proud that the Gutstab project has been recognized by the Women in IT Excellence Award in the UK last year, where I won the Innovator of the Year award. And BBC have also reported the EBAC, the Games for All project for children. So there has been a lot of interest and a lot of impact, because a lot of the work we do isn't just generating a scientific knowledge, it's actually helping people through these interventions to manage their life or increase their knowledge of public health. And on the back of it, we are generating the new science and policy advice. So if you want to get involved, do get in touch with me. The Center for Digital Public Health in Emergency is part of IRDR, and you have got an overview of the kind of activities we do, and we really look forward to working with you in either teaching you from September onwards. That will be exciting to get involved in some of those projects, or getting involved in some of our research activities, just like the My Lockdown Journal project, which is going on right now. And I would like to thank you to all my colleagues from obviously UCL DPHE Center and from the previous at the University Center, where we developed the EBAC project for children, and all the teams in the Mantra, Zika and Gutstab based in Brazil, in Africa and in Nepal, without whom these projects would be impossible. So the global collaboration, the stakeholders who work with us and partners all around the globe contribute the local knowledge and engage the local users are essential for the success of any of these public health interventions. If you want to get in touch, this is my email, or follow me on Twitter, or follow the UCL DPHE Center on Twitter to learn more about the exciting stuff we do at DPHE, or we also sharing a lot of cutting edge information about digital public health.